Okay, and now the final topic before we get into the concept of tumors in children will be the biggest killer of infants under age 1 that are not due to prematurity or congenital anomalies, and that's SIDS, sudden infant death syndrome. Like all syndromes, it does not have a specific etiology, which is why it's called a syndrome. Otherwise, it could be upgraded into an actual disease. But we'll talk about risk factors uh, in terms of possible causes or relationships, the epidemiology of the disease, something about morphology. Actually, there's not much about morphology because there are no consistent findings. And a little bit about the pathogenesis of disease, which is also scanty because, once again, there are zero, or usually almost zero, anatomic findings, which means we can't talk about what happens with the cells as the disease progresses because we don't know if there are any specific consistent anatomic changes. The NIH definition of SIDS, sudden infant death syndrome, is a sudden death of an infant under age 1, uh, which remains unexplained after a thorough case investigation, including performance of a complete autopsy, examination of the death scene, including police, and a review of clinical history. So, as you can see, because of that definition, it's basically a diagnosis of exclusion in which there are no anatomic findings. If you found anatomic findings, you can actually diagnose the disease. If you don't have any anatomic findings and you have so-called circumstances that are classically present, you can diagnose the syndrome. It's also called crib death, totally synonymous. Crib death is SIDS, sudden infant death syndrome. It's the leading cause of death in the USA in kids between 1 month and 1 year. It 90% of those, however, are less than 6 months. So it's really a disease between 1 month and 6 months of life. Not too many occur in the second half of the first year. And we have about, what, 3,000 deaths now. It's been significantly down. It's been about half of what it was, let's say, 10 or 15 years ago. Why? Perhaps because some of these awareness things we'll be talking about. There are risk factors for SIDS. There are no causes, but there are risk factors. The risk factors are parental, infant, and environment. A young mother is a risk factor. Maternal smoking or drug abuse, alcohol, risk factors. Short intergestational intervals, mothers that have frequent babies and not much time between, another risk factor. Low socioeconomic group, little or no prenatal care, and classically, the American Indian and African American communities have a much higher incidence. So that could be related to socioeconomic as well. In the baby side of the risk factor, the infant, um, sometimes there are a few reported brainstem abnormalities. They're not consistent. There's nothing you could say that is you want to put on the books or show a picture of. It's more thought of as being a physiologic uh, abnormality in terms of cardiorespiratory control, but a prematurity and low birth weight is related to it. Males more likely than females. Multiple birth or twins, triplets more likely to have SIDS. SIDS in a prior sibling more likely to have SIDS. And antecedent respiratory infections in the baby as well. In terms of environmental or things, which are the controllable things, babies that sleep in a prone position are more likely to have SIDS. Sleeping on a soft surface is a relative risk factor. Hyperthermia, as well as passive smoking, secondhand smoke, also risk factor. Um, Once again, SIDS is a diagnosis of exclusion. I did a few autopsies on these cases, and they basically want you to find something that shows that there's SIDS. Well, what people don't realize, it's not finding something or not finding anything is the thing that opens the door for the diagnosis of SIDS. There are often a lot of uh, nonspecific findings that you might find in any case where there's been some type of anoxia, like multiple petechiae, pulmonary congestion. These are all nonspecific terminal events, pulmonary edema. Uh, these are very regarded as agonal changes that occurs in people that die, no matter what the cause is. Sometimes there are subtle changes in brainstem neurons, but I'm not going to show you a picture because they're inconsistent. But it may help to explain why classically we're talking about problems that may be in the cardiorespiratory control centers. And once again, if you want to have a possibility of diagnosing SIDS, you have to have a negative autopsy, not a positive one. The pathogenesis is generally regarded to be multifactorial and unfortunately not really very anatomical. Let's just say there's a triple risk model characterized by the fact that a certain type of infant, like we described with all the risk factors, will be in a vulnerable situation. And let's say there's a critical development period in which there's a problem in homeostatic control with a combination of exogenous stressors. And basically, this is the pathogenesis. If you do careful autopsies on SIDS babies, you may find some subtle, inconsistent, non-consistent, non-repeatable brainstem anomalies, which of course could be explain the lack of cardiorespiratory control and death. There are preventable factors. We talked about all of the maternal baby environmental factors. Certain of those can be controlled. You know, on the maternal side, it's basically get better prenatal care. You know, be careful about smoking, drinking, blah, blah, blah. But most of the prevention or most preventable factors with SIDS, which might be the reason why the incidence is about half of what it used to be not too long ago, are things like avoid prone sleeping. Babies that sleep prone are more likely to suffocate. You know, that makes sense. Babies that sleep on soft things which are more likely to suffocate them are can be aware of that for prevention of SIDS as well. And because hyperthermia, whether it's due to a lack of some homeostatic control in the brainstem or whether there are environmental factors, can be avoided just by setting a thermostat to an appropriate temperature and not using space heaters. Okay, so what's done in SIDS? Well, first of all, there's a complete autopsy. We said it's a diagnosis of exclusion. There's an examination of a death scene. There's usually a very careful police investigation. There's a review of the clinical history. There's a review of the risk factors. And of course, the big social differentiation rather than disease differentiation, although it's a social disease, is to make sure there was no child abuse. And I don't know, you may have known parents who have had SIDS babies, and probably the most horrible thing to go through, actually there is no more horrible thing to go to, but when you add to the fact that they are often being looked at as possible murder suspects, and there is this big cloud of child abuse, child neglect, intentional or unintentional, involved. I mean, it's something that psychologically they may never recover from. Okay, let's call it quits here. We did 10 minutes, and let's see if we could do two more and one or two more clips. I thank you very much.